You're good to go.
Hello, welcome. Thank you for joining. We're going to get started in just a minute or two. Hello, everyone. My name is Kylie Lance. I work for the Center for Health Equity and Community Engagement Research at Mayo Clinic in Rochester. It is my pleasure to welcome everyone today to our final Cancer Town Hall of 2022. And it is my pleasure to welcome the attendees, but also our panelists as we highlight the very important work of patient navigators in the Mayo Clinic Comprehensive Cancer Center, as well as social workers as they serve and support cancer patients. I would like to now introduce our host and moderator, Angie Young. She is the supervisor of the enterprise-wide Patient Navigators. Thank you, Angie. Take it away.
Thank you, Kylie. Good morning and good afternoon, depending on what part of the country you're in. So just wanted to speak on behalf of all the panel members. We're honored to be here today and excited to share more about the supportive resources that are embedded within the patient navigation and social work teams. We do have another panelist joining us here, so we'll give Michelle just one moment. So I will be facilitating today's conversations. We encourage you to post any comments or questions you have in the chat. Myself and the staff members will do our best to share resources and manage the chat as we go through the webinar. We'll also field any unanswered questions following the event. I am going to share my screen here. Okay, can everybody see the PowerPoint here? Yes? Okay. So I would like to introduce our first panel member, Brandon. Brandon's a general patient navigator based in Rochester, Minnesota. He began his career with the Mayo Clinic in 2017 as a certified nursing assistant and has been in his current role since July 2021. Brandon graduated with a Bachelor's of Science from the University of Wisconsin-La Crosse. During his education, he completed a clinical internship at Advocate Lutheran General Hospital. Brandon intends to earn a master's degree and is interested in pursuing a career in healthcare administration. Brandon, I'm going to turn it over to you to start the presentation.
All right, sounds good. Thank you so much for having me. So first, what I want to do is talk a little bit about what exactly is patient navigation. So patient navigators are part of a multidisciplinary care team offering non-clinical support. Our role as patient navigators is to identify and assess patients' needs, address barriers to care, and connect them to appropriate resources. Patient navigators also offer support across the patient's entire cancer journey, which includes follow-up care. Specifically at the Mayo Clinic Comprehensive Cancer Center, Patient Navigation is an enterprise-wide program where we have a presence at all 3 of our Mayo Clinic campuses. This includes Rochester, Minnesota, Phoenix, Arizona, and Jacksonville, Florida. Next, I want to talk briefly about the 2 types of patient navigators we have here at Mayo Clinic. The Comprehensive Cancer Center has both general patient navigators, such as myself, who assist all patients in disease groups, as well as patient navigators who serve specific cultural patient populations. Currently, we have navigators on staff serving these communities, which include Hispanic and Latino, American Indian and Alaskan Native, and African descent. These populations were identified as Mayo Clinic strives to recognize the unique challenges and barriers some of our patients and their families face. As these needs are being recognized, we look forward to expanding the patient navigation program to ensure patients coming through the doors of Mayo Clinic can receive the timely care that they need. Next, I want to talk a little bit about the typical areas patient navigators can provide support in. The first one that we have is lodging options. Many of our patients are traveling long distances to come to Mayo Clinic for treatment, so we help them find affordable housing during their stay here. Next is emotional support. We recognize that a cancer diagnosis can cause a lot of stress, so we're here to help to listen to a patient's concerns and connect them to other appropriate resources as needed. Next is employment concerns. A cancer diagnosis can impact abilities of a person to work. So we can help patients explore various options such as FMLA, disability, and work accommodations. Next are financial assistance options. When a cancer patient can't work or has additional bills, it can add to a lot of stress. Patient navigators can help assess financial needs and connect patients to specific resources. Next is insurance concerns. We understand that understanding insurance policies can be complicated, so we can help answer any questions about insurance, copays, and cancer policies. Next are local community resources. There are many people in the community who want to help. We help connect patients with programs in their areas that can help find rides for errands, meal delivery, visiting companions, wellness activities, and more. Next is navigating locations. It can be overwhelming finding your way around our cancer center during your visits here. We can assist with questions regarding on-site parking, the best route to your next appointment, as well as identifying lodging accommodations that meets patients' needs. Lastly is transportation options. We can help patients explore various transportation options based on the distance and frequency they need to travel, both by ground and by air. The final point I'd like to touch on today is how our patient navigators are working across all three fields of Mayo Clinic. Patient navigators are very active across our practice, research, and education fields by working closely with care teams, offering educational support, as well as supporting clinical trial research. For example, patient navigators are educating our patients by providing them printed and digital materials on what a clinical trial is, and providing them with very introductory information so they can familiarize themselves with the process of a trial. And in some cases, we might even explain the different phases of a trial for a clinical trial patient at a very basic level. That way, they are better prepared to have those discussions with their doctors, as well as being able to self-advocate and ask informed questions. And for a patient that does decide to enroll into a trial and needs to stay here for treatment, the patient navigators will address barriers such as lodging, transportation, or financial assistance so that they're able to receive that unique care. Next, I'm going to pass the conversation off to my colleague here.
Thank you, Brandon, for sharing more about the patient navigation role and explaining how the patient navigation team supports patients and their caregivers along the entire cancer journey. In a moment, we'll hear more about the patient navigation role and how closely we work with our social work colleagues to support our cancer patients and caregivers. First, I would like to introduce the last three panelists that will be talking further here in a moment. Veronica is one of our culturally specific patient navigators, serving those of African descent based in Jacksonville, Florida. She has served in her role for a little over a year now. Veronica graduated from Georgia Southern University with a Bachelor's of Science and later went on to earn her Master's of Science in Healthcare Administration from Seton Hall University. Veronica's philosophy of servant leadership is instrumental in building trusting relationships with her patients and their families. Michelle has been a social worker for over 20 years and has been a member of the Mayo Clinic staff since 2016. Currently, she serves as a licensed clinical social worker in the Department of Hematology Oncology. She provides support to oncology, cellular therapy, and benign hematology patients and caregivers at Mayo Clinic. Her extensive medical background includes palliative hospice care. She has served on the Mayo Clinic's Ethics Committee since 2018. And lastly, but not least, Mr. Baker is a patient at Mayo Clinic Comprehensive Cancer Center in Jacksonville, Florida. Mr. Baker was previously an over-the-road truck driver in which he had a great passion for. Since his cancer diagnosis in 2021, he has worked very closely with Michelle and Veronica to overcome challenges that he faced during his cancer journey. Mr. Baker enjoys spending time with family and going fishing with friends. Due to Mr. Baker's cancer journey, he is unable to join us live today, but he did agree to pre-record an interview with us in advance, as he sees the importance of sharing his story and how working closely with patient navigation and social work helped him overcome barriers to care. So Veronica, I'm going to pass it over to you and I'll advance to the next slide.
Great. Thanks so much, Angie. So Brendan talked a little bit about the general patient navigator role, and I'll be talking about the culturally specific role. So culturally specific patient navigators operate very similar to the general patient navigator role. The primary distinction between these two roles is how soon connections are made with patients. Our goal as culturally specific patient navigators is to connect with patients as early as possible in their cancer journey. We understand that it is often worries or concerns outside of a patient's diagnosis that impacts their level of engagement in their medical care or even making it to that very first appointment. We identify patients through a report in our electronic medical record, in which we use to make outreach calls to new patients before their first appointment, and also existing patients who may not have connected with the patient navigator in the past. Once a patient self-identifies by race or ethnicity, they're populated onto the appropriate navigator's report. We will then make a welcome or introduction call to identify non-clinical barriers or concerns a patient may have. During these calls, we share our contact information, including phone numbers and email addresses, so that the patient will have a point of contact for issues that may arise or for just general inquiries. If it is the patient's very first appointment, they may feel anxious or overwhelmed and may not be aware of the resources they need or barriers they may encounter along the way. I often hear from my patients, I'm not sure what to expect or what will this look like for me. And at that time, a follow-up call is scheduled after the patient's first visit. Once a patient receives an official diagnosis, we provide support throughout survivorship. Providing ongoing or intermittent support to a patient with complex needs makes a world of difference when they've had limited experience with the medical system. And not all patients we encounter will require the same level of support. We truly meet each patient where they are. As culturally specific navigators, we have the flexibility to walk more closely alongside patients and identify concerns or challenges more quickly before they become overwhelming impacting the patient's care. The work we do as culturally specific patient navigators have a profound impact on a patient's overall experience as we help to bridge the gap in underserved and underrepresented communities, whether it's helping to alleviate medical mistrust by allowing the patient to be open and communicate their fears or doubts, the impact that historical inequities have and the intentional harm caused in communities of color contribute greatly to a patient's reluctance. These patients are often labeled as non-compliant or maybe even difficult when it's actually just fear. However, we do begin to break down these walls that have been built over time by developing trust, increasing medical literacy, and helping to establish an open line of communication between the patient and their care team, so they feel comfortable with asking questions or communicating concerns. Being aware of potential cultural misunderstandings as a navigator help us to advocate for the patient and be educators to the care team. Culturally specific navigators across the enterprise have a deep understanding of the cultures they support and are able to better serve the community. Providing language support services to a patient in their preferred language can impact the patient's experience greatly. This will result in greater adherence to treatment plans and fewer missed appointments. It is important that patients can communicate and be served in their preferred language, including educational materials and forms. We're able to bring these concerns forward to the team and create a plan when gaps are identified. We also help to coach patients to self-advocacy, which ultimately empowers them over time to become active and engaged in their care, whether it's providing guidance on financial resources, insurance, employment, or creating an action plan to better manage complex needs. We're here to support our patients as they begin to piece things back together. This also includes triaging support when it is appropriate. It's important that patients have access to spiritual and or emotional resources, including chaplain services or therapy services offered through our social work department. We help to normalize and validate what the patient's feeling as much as we can. We empower our patients to self-advocacy, which over time builds trust. Each patient comes with their unique needs, so it's important to understand that not one shoe fits all. We meet the patient where they are and we start there. And by providing this individualized support, we're able to identify barriers and challenges sooner and have early intervention, which leads to improved health outcomes. Having culturally competent navigators who can help advocate and coach patients along their journey is critical because we have less patients to fall through the cracks. In addition, we help improve a patient's overall experience at Mayo Clinic. As a patient navigator serving those communities of African descent, I understand how certain cultural differences, mistrust, and disparities can make accessing timely care more challenging for our underserved populations. A cancer diagnosis can change your life in an instant and bring on so many emotions and uncertainties. We're here to help restore hope and ease the mind of the patients we serve. Michelle can speak with you a little bit more about the impact that social work has in a patient's journey.
Thanks, Veronica. So I just wanted to kind of go through a little bit of what oncology social workers help with. As Angie has stated, we're licensed clinical social workers, and we kind of look at the whole person, and looking at as being an advocate and liaison as a patient continues to seek treatment, and even being newly diagnosed all the way through when patients are maybe on surveillance or are in remission. So we provide that ongoing support, and in addition, providing resources throughout their journey, knowing that patients changes occur, and patients are constantly needing different resources, different support during their journey at different times. So we're looking at taking care of the entire person and providing those resources. Helping the patient to really understand their new roles and responsibilities. Sometimes that is understanding that sometimes their relationships change, and that is sometimes due to the patient and caregiver role that sometimes enter into these situations. Also helping to understand how relationships can change within a family, and within relationships, sometimes within a marriage. So that's providing all of that support, not only to the patient, but to the caregiver. We also, very similar to Veronica and the patient navigation, we are the bridge to the medical team, and providing that support as they have questions or concerns, sometimes even being present during consults and explaining to the patients. Sometimes they have questions or concerns and they don't know how to ask the medical team. So that's support we also provide. Accessing resources, and that could be insurance, that could be questions regarding employment, job, Social Security, long-term disability, short-term disability, and accessing those different resources. Also, there are concerns, as Mr. Baker has expressed during his interview today. There were concerns regarding insurance and paying insurance premiums, and also having continued insurance throughout the process as his employment changed. Also prescription insurance, and affordability of medication costs. Sometimes those are a concern, as well as financial, meaning non-medical expenses. And that also, there are resources that social work and patient navigation can help with throughout that journey. And then also adjusting to some of the changes, whether those be physical changes, emotional changes. So those also are things that we assist with as well, and helping the patient to kind of process some of those thoughts and feelings that they're having throughout their journey. So with Mr. Baker, the way that we initiated contact with him was one of our physicians had met with Mr. Baker in the hospital after he was newly diagnosed. And there was a concern that the patient had brought up to the physician regarding his insurance and the continued coverage that he would have. And there was a concern whether he was going to be able to continue to afford to receive medical care. So when I met with Mr. Baker in the beginning, he was in the hospital. He was physically, he was not doing well. He was in much pain. And there was a concern that he had expressed to me about medical and non-medical expenses, as well as his insurance coverage. And he really didn't know where to begin. So, and he had just received this diagnosis. He had never been sick before. He had never really been in the medical system, limited support. And so he was really asking for assistance, but he didn't even know where to begin. So I knew right after that visit, I ensured him that we would have a team that would be supporting him as he continued his journey, and we would be there when he got out of the hospital. So I had contacted Veronica, knowing that he was going to be discharged from the hospital in the next few weeks, and we came up with somewhat of a plan of action on how to kind of surround Mr. Baker and help him navigate and get the immediate resources that he needed to continue seeking treatment here at Mayo Clinic.
Yes, and
off to Veronica.
yes, so Michelle and I, we played a very instrumental role in helping to assist Mr. Baker through everything that he went through. We ensured that he wasn't lost to follow-up, that he made his appointments, and we kept the team up to date with pertinent medical information because we were often the first to hear of his concerns, whether they were medical or non-medical. He felt safe with us, and we had built that rapport with him over time. But of course, with the medical concerns, we ensured that the appropriate medical team received the information that could greatly impact his care. Alongside Mr. Baker, we established accountability and we agreed on responsibilities. We even made an action plan together to ensure that we all stayed on track. And mostly important, we ensured that he kept an open line of communication with his care team. And over time, Mr. Baker has learned the importance of self-advocacy. He's become empowered and overall more involved in his care. We now get to hear from him and in an interview that was pre-recorded. In his own words, you will hear the importance of working with patient navigation and social work during his journey.
Miguel or Kylie, are you able to get the recording started for Mr. Baker's interview? Oh, it looks like we had some technical difficulty. Maybe Kylie fell off.
Kylie is logging in again.
Okay, sounds great. Thank you. We'll give her just a moment to get that pulled up for us.
Thank you, Mr. Baker, for coming today and just kind of telling your story and your journey as you've been here at Mayo Clinic. So we appreciate that you're here today and talking with us and kind of sharing a little bit of your story.
That's fine.
When you were first diagnosed, how did this kind of impact your life as a whole?
Altogether, it just changed everything. None of the things I used to do, I could do anymore. I mean, things I used to didn't worry about doing, you know what I mean, became a struggle. Paying my bills, being able to, go to work, being able to live. Everything changed.
So you feel like it kind of changed your whole life, not just your everyday life. It impacted your ability to pay all of your medical and non-medical expenses.
Yes, ma'am. If it wasn't for the help that you and Miss Veronica gave me, I don't think I would even be in no position right now, in the position I am right now, as far as, working to get back on the right track. I'd probably be worse off, you know what I mean? If not, sicker than I am now, because I was helped mentally, financially, and emotionally through, y'all help, you know what I mean? As far as, giving me the things I need to get to where I am today, you know what I mean? Which I'm not all the way there, but at least I have an idea of, what I'm going through now. Then in the beginning, it was real, real rough. And I had no idea on how I was going to handle it or what it was going to do to me. So I appreciate what you and Miss Veronica did, to get me to this point now and to where we can, work together and, figure out things without me getting all depressed. And the worst thing I think is not knowing how you're going to make it to tomorrow. You don't know everything, but you want to have an idea, hey, if I get up, I'll be able to do this, I'll be able to do that. But when you're in a situation like this, you don't know what, I may wake up tomorrow and my breathing is off, you know what I mean? And I can't get out of bed all day tomorrow. So, learning different things I need to do when those situations come up and how I'm going to make it through those situations, it's got a lot better.
I know the insurance piece was a real big challenge for you. Where do you think you would be today if we hadn't have gotten that all squared away and pieced together for you?
Has no idea. Has none. I guess going from hospital to hospital, from doctor to doctor. And in my case, I don't think that would have been good, because, you never get any definite answers because I'm seeing this doctor from this hospital, then I'm seeing this doctor from this hospital. And both of them, it's like that the thing that got me here, misdiagnosis. I was diagnosed with some type of skin, what it was, allergic reaction, and that's what had been treated for from 2 different doctors. And just so happened, I was this was the 3rd hospital, and I happened to be in the emergency room here, and a doctor, a skin doctor, was happened to be on duty and seen me and say, oh, I know what's wrong with him. And she ran some tests and, come back to, I had some type of skin cancer, And that's how I be, running from doctor to doctor, just getting treated for the symptoms. Never, never getting a solution, you know what I mean? Never really find out what's going on. They just treat me, okay, he can't breathe. Well, I gave him some, steroids and something for the pain, and, I started feeling good, and they sent me on home. 2 weeks later, I'm back at the hospital for the same thing. Give me the steroids for the allergic reaction and the pain pill for the burning and all that my skin is going through, and back out there, I go through that. I went through that, you know what I mean? And finally I ran into a doctor that knew what was going on. So that's probably what I went through. And that would have had me to where I can't work, which I can't now anyway, but at least I know what's wrong with me. I can't, maintain, a roof over my head. I'm in a bad way, I can tell you that.
Mr. Baker, we've worked through so many different things together. What did you find most helpful working with patient navigation and social work?
The help you gave me with getting my my insurance caught up, that was a lot of work we did there. And that helped me to stay at one spot instead of going all over the place trying to get help. I can maintain help in one spot.
So as we've kind of helped you to piece things together within the medical aspect and kind of helping you to navigate the system and help you during appointments and being there for appointments, that's kind of helped out as well?
I have had no problem with y'all assistance as far as financially. I mean, if it was some way that you could work it out for me, or we could work it out together, it was done. For me, it was being able to trust someone with everything, with my health, with my financial problems, and I've always been able to do it for myself. But through you and Miss Michelle, I mean, yes, y'all got me through a lot as far as financially. My bills, home bills, all I had to do was just listen to y'all, and then y'all didn't just throw it at me. That's another thing I like. Y'all didn't just say, hey, go to this website, fill out an application. You or Miss Michelle walked me through step by step, and did a lot of it for me. Walked me through it step by step. I mean, because I would have had no idea on how to deal with that type of thing. I never had to, And if you'd have just gave it to me like that and say, Michael, this is such and such contribution. Go online, put in the application, and they will help you. It would have never got done because I wouldn't know where to start. Even though you gave me the website, I still would have got lost somewhere.
If you could share anything with the people that are here with us today, what would you want them to take away from your experience?
If you got someone that's willing to help you the way I did, it's best to be open with the person that's working with you. I got more done just by, being able to open up to you and let you know exactly what's going on, and us working together, being able to find a solution to the problem. You know what I mean? But if I don't say nothing, ain't nothing you could do. But if I'm working with you and I'm letting you know what's going on, everything I'm letting you know, well, Mr. Baker, I can let me look into that for you, and you being able to do that and come back, well, I found this solution. You think you're being interested in this?
So that continuity of care is really important, especially when you're being treated for, this diagnosis that you have here today. And I'm happy that we were able to help you along the way and identify the appropriate people to speak with regarding these issues.
When you get the help that you need, it gives you time to deal with other things. You can't, at least me, I can't deal with a bunch of stuff rushing at me at one time. If I can get some help to get something straight, maybe I can work on the next thing. I appreciate that part, you know what I mean? Okay, you helped me financially, but now I can look after me medically.
So this kind of was very helpful when we were able to kind of unload some of that financial stress. You were able to maybe focus more on your health and your medical care because we weren't worried, right? In the beginning, I think we were very worried about the financial situation and how that was going to impact everything, even your ability to keep your insurance. So when we were able to offload some of that and get you some assistance, you were able to focus more on your medical care. Is that correct?
Yes, ma'am. Absolutely. When you don't have to worry so much about your bills, it gives you more time to think about your health. If I'm always worried about my bills, it's making my health even worse because I'm not taking the time with it at all. I'm worried about paying that rent, even though I need my health more so. But I know I need a place to over my head. In the end, I know I need to pay my light bill. I know I need certain things in life in order to live a decent life. And yes, when y'all helped me in that way, which I was surprised. I mean, you came in, you talked to me, you said, Mr. Baker, don't worry about that. I'm gonna help you out with all those things when you get better. And I didn't see you no more for a while. But before I got out, you was there, and you presented to start working on helping me right at that moment. And then you introduced me to Miss Veronica. And from there, me and Miss Veronica went to work. I mean, the same day. I hadn't even got home yet. And y'all started giving me the help that I needed. And even when I was in the hospital, it was different people that y'all sought to help me as far as getting my finances back on track and helping me get the assistance I need to pay my copay for my insurance because I was no longer in a position to pay it anymore, and the company wasn't paying anymore.
At the end of the day, we're all a team, but you were the most important piece in that puzzle. We couldn't do this without you. And you are the reason that we work so hard for the many patients that come through the clinic every day. And we want to thank you for playing your part and, being an advocate for yourself as well.
I just want to say, I want to thank everybody that was there for me and still is, through this, what I'm going through, and always be there when I'm having problems and helping me to get my life back, on I won't say the way it was, but back to where I can, I don't have to worry as much. And I want to tell you and Miss Michelle, thank you for all your work. And the doctors and nurses that, I have, been under. Everybody, always did good for me. And I want to say thank you.
Veronica, I will pull back up the PowerPoint.
And while you do that, Angie, I'll just say how powerful it is to always be able to hear from our patients. And I can say, like me and Michelle, we're always running around doing this, doing that, but we never take a moment and see how we're impacting the patient's life. And to just sit here today and hear the patient that we've both been working with, it's just so powerful, and it speaks volumes to the work that we do each and every day. Um, and recently we've spoken about the relationship or the collaboration with patient navigation and social work. But for patients who have a cancer diagnosis with complex needs, it's important that their care is coordinated. This allows them to navigate effectively and efficiently through the healthcare system and avoid delays in care. Um, Here's a visual of the team members that we often work with, and each play a very important role in the patient's journey. Michelle, do you have anything that you would like to add?
Thanks, Veronica. I agree with you. It's very powerful sometimes just sitting back and listening to Mr. Baker's story. we worked so hard to support him and continue to work so hard to support him through his journey. There's been ups and downs and challenges, and I think every day there's maybe some good that comes from it, but then maybe there's another challenge too that we have to look and start thinking. I think Veronica and I did a lot of thinking outside the box, putting our heads together. There was a lot of collaboration, not only from Veronica and I, though there are 2 or 3 other social workers in our department plus another navigator. And sometimes we would just do roundtable discussion, like what else did we miss? What else can we do? Another perspective, sometimes we would work with, our patient financial counselors as well and bring them in to just try to figure out a really solid plan for this patient so we could take some of those stressors off of his plate. And again, the goal is to remove all these barriers and stressors from the patient and minimize, decrease those stressors as much as we can so they can really focus on their care and getting well and healing, not only physically, but emotionally as well. So we're there to really support the patient. And I think it really takes this picture kind of just shows how much it takes kind of a village to support a patient sometimes. Like it takes so many different aspects. I think what Mr. Baker brought up is the unknown. A lot of our patients, there's big concern and a lot of concern about what's going to happen next. What's the next part of this journey and what's going to happen to me next, physically and mentally and financially. Many of our patients will not walk in here and say, I have no financial concerns. Everything's great. Michelle, great support. A lot of times there are these missing, there are barriers, there are concerns, and that's why we're here to continue to support the patient. So things do change and we're here as they change, and we're here to pivot with the patient and figure out what resources they need at that specific time. And I think a lot of times, we continue to follow our patients because there are changes that occur. It's not kind of a one time that we meet with a patient and then call us as you need us. We know very well that the patient may not reach out to us, but we need to reach out to that patient again, just to ensure that, they have all of their needs met. Thank you, Veronica.
I was just going to say thank you, Michelle, Veronica, Brandon, for presenting today and doing a fabulous job. And I would agree, Mr. Baker's story is one that's very compelling. It's very obvious that he's extremely appreciative of the support that he received, both from Veronica as Patient Navigator and the collaborative kind of relationship that we have with social work and patient navigation, and really working as a team to support him and continue to support him. And the reality is that Mr. Baker's journey is not a unique one, right? A lot of our cancer patients have similar struggles. As Veronica mentioned, no one patient is the same. They all have unique differences and unique stories. But the reality is most of our patients need some type of support along the way. And so I think our goal in presenting today is really to just sort of, if nothing else, normalize that this is new. This is a new journey for many patients, and many people haven't had to deal with a big medical event. And a lot of this is very new. Insurance is new. Not being able to work full time is new. And how do we manage that? How do I have conversations with my medical team? And unfortunately, in the cancer realm, these conversations that are really important happen very quickly, and they're very early on when most patients and their families are still very, very overwhelmed. So I think part of our role too is to help patients process and really kind of think through what maybe questions they have or who they should reach out to. And really, if nothing else, just giving them permission to be part of that kind of care team, multidisciplinary team model that we have there on the screen. I think I'm going to stop there and just see, Kylie, do we have any questions?
Thank you all so much for all that great information. There are a couple questions and we do have some time, and I'll open these up to all panelists, so feel free to chime in and answer. We have a question in the chat that you guys talked about using phone and email to communicate with patients. How about using the portal for communication? Is that a barrier? In which form of those communications have you found most effective?
So I think I was the one to speak about the phone and email, and absolutely we do utilize the portal. But the realization is a lot of our patients prefer phone over using electronics because they're not technology savvy. So we try to meet the patient where they are. And so if we see that that's a barrier for them by communicating through email or the portal, we definitely use that time to reach out to them by telephone.
I think also, Veronica, we helped and we still continue to help patients. Sometimes they have questions on how to use the patient portal. And so that is really the way that they can connect with their medical team. So Veronica and I have helped patients sometimes to compose an email or a patient portal message because the patient really had some concerns and they really wanted to send the portal message, but they were just struggling to put that into words. And sometimes it's just kind of talking that out with the patient, finding out what their concerns are, and then kind of just walking them through the patient portal and empowering them to do that. And I think in this case, that's what we did. And now it's becoming a little bit more comfortable with the patient portal. So it's important sometimes to really walk the patient through some of this because if he didn't use the portal, he wouldn't know how much of sometimes it's very helpful when they have a quick question and they want to get to their medical team. So he's now getting more comfortable with it, and that's important to empower him.
I think the other thing I would add to that is, you're right, Michelle and Veronica, helping patients better understand the use of the portal and access is really important. And I think as patient navigators, we oftentimes will discuss that with patients. The flip side, the other side of the coin that we oftentimes see is that patients have signed up for a patient portal and or maybe a family member has signed up for the portal. And so maybe it's a son or a daughter or a spouse or a brother, sister. And we will find that if we pay attention and we do try our best to monitor patients' actual use of the portal and are they reading their messages, because just because they have the patient portal, we're finding is not a safe assumption to say that's the primary means of communication or the preferred means of communication. And so we do, as patient navigators, try to go in and make sure that when portal messages are sent, that they're actually reading it. Because we will find that patients will say they weren't made aware or were unaware of a change, and it was communicated via the portal, but when we go do some digging, they didn't actually read it. So we do try to, be mindful of that as well.
Thank you. Another question. I know that Brandon touched on this. Oftentimes, as new treatments are being developed, clinical research trials are an avenue for patients to receive care. Can you guys expand on how, as a patient navigator, research is weaved into your role, especially as it relates to kind of building those relationships and kind of creating that trusting relationship, given the history there too with some of the different communities we serve?
Veronica, did you want to touch on that a little bit with your role?
Yes, I can. Definitely, one of the main points that I would like to bring forth is when there is a clinical trial that a patient may be interested in. If they don't have all of the information, they may be a little bit hesitant. So our role as patient navigators, we provide that literature, that information, connect with the clinical coordinator to provide further information. Our role is very high level. We just provide the information and provide the contact to get the patient connected. Um, and that's how we help the patient as patient navigators.
Yeah, thanks, Veronica, for explaining that. Brandon, did you have anything to add?
Yeah, one thing I kind of want to add along with that too is that with clinical trial research, there's oftentimes a very large stigma around what clinical trials research is. I think one of the biggest fears that patients have is that they'll be treated as a guinea pig if they enroll to a trial. So really our role as patient navigators is helping kind of eliminate many of those myths and informing them of really what the trial is and showing them the benefits of that. So.
Yeah, and we really try to do that as early as we can. Ideally, we would like to connect with these patients, as early into their journey as possible. Oftentimes, if we can even get them before they come to Mayo Clinic for their appointments, we much prefer to do that, but it's not always an obtainable goal. But we part of that reaching out is really just conveying that message to patients that Mayo Clinic is a comprehensive cancer center. There is a fair amount of research that happens here. And we really want patients to understand that in addition to standard of care, providers are going to talk to them about clinical trial research. And really just, as Brandon alluded to, giving them really the facts and allowing them to kind of mentally prepare and become educated on what is clinical trial research in cancer care. So it's different than healthy volunteers where you might get placebos, but really want them to hopefully come prepared so they can engage in that conversation with the healthcare team. And then I think the other part that where patient navigation will get pulled in is if a patient does decide to participate in clinical trials, oftentimes that means they need to continue their care at Mayo Clinic. And a lot of times that includes additional visits, more frequent visits, which means maybe transportation, lodging, financial barriers. And so we don't want those barriers to be a reason why patients choose not to participate in research. So part of it is educating on the importance of research, and then also letting them know that if after they've met with the team, if they feel their best treatment approach is to enroll in a clinical trial and the barrier is going to be transportation or lodging or financial, we want them to come back to us or reach back out to us, because that shouldn't be a barrier to participating in clinical trials. So we want them to come back to any one of us on the team.
Angie, I would just like to kind of just say a little bit more on what you just said about coming back to the team. I think that's very key here. Veronica and I spend a lot of time building trust and rapport with patients because a lot of times they are okay for a little bit, and then all of a sudden something comes up and they remember us. They remember the support that we provided, and they will reach back out to us. And that is key. So really making sure that they feel comfortable with us and asking some of those questions. Sometimes they just don't feel comfortable asking the medical team. And so they want to process some of it with us first before they start talking with the medical team about it. Sometimes they just want to come up with a list of questions and concerns, and then they'll ask us, how do I approach this? How do I ask these questions? And so we give them kind of that knowledge and empower them to do that. And that's been very helpful.
Thank you all. I don't think there are any other questions that have come in.
Perfect. I would just ask, do any of the panelists have any other thoughts? We have just a few minutes. Any other thoughts that anybody wants to add, or things that you remembered that we didn't share? No? Okay. Kylie, I think if you don't have any other questions, there's nothing really more that comes to my mind either.
All right. Well, thank you all so much for coming together to make this, again, the final Cancer Town Hall of 2022 happen. It's just, and I know this space has grown, and just hearing information about these culturally tailored patient navigators is wonderful. So thank you for coming together to showcase this very important, coordinated, and comprehensive approach to supporting the cancer patients at Mayo Clinic. It's so important what you do. So thank you all so much for coming in today to talk to us about it.
Thank you, Kylie, for the invite. Much appreciated.